Hello, my name is Tobias Shea. Today I'm going to talk to you a little bit about my experience with harm reduction and how it can be used to help people who are suffering with substance use disorder. Generally speaking, I'm in favor of harm reduction. I appreciate the moderate stance that harm reduction takes, understanding that ideas like abstinence and sobriety aren't necessarily realistic, and human behavior should exist on a spectrum rather than polarization that often happens where we must have 100% of one thing or 100% of another thing. I would say, generally speaking, I'm an 8 or a 9 as far as being in favor of harm reduction. I do understand that there are people who will function better with 100% sobriety or 100% abstinence from whatever the substance or behavior they were addicted to. But generally, I see quality of life as the most important aspect of this conversation, and anything that can be done to reduce suffering and improve quality life, I'm in favor of. I haven't always viewed harm reduction this way, mostly because I'm only recently familiar with the idea. My father and my favorite aunt, his sister, were in a variety of alcohol rehab situations when I was younger, and I saw that it was really challenging for them to maintain 100% sobriety. So I guess that would be kind of my first experience with understanding how to help someone navigate addiction without punishing them for relapsing or not maintaining 100% sobriety. I think more recently, obviously since I've been in grad school, and also because of the experience I had working in homeless shelters with homeless veterans, that has also shifted my perspective on harm reduction, seeing that usually substance use isn't the only issue. It's often comorbid with some kind of mental illness or some kind of past trauma. And usually the substance use is some kind of a coping mechanism. So when I think about harm reduction now, I think about how can we help empower people and give people skills they need to cope with the trauma or the mental illness that they're suffering with, and reduce their need to use other substances as coping mechanisms. All right, the next question is pretty complex. How can psychological dimensions of addiction influence or direct a psychotherapeutic counseling treatment of addiction through a harm reduction lens? I think what we're getting at is different ways to accept each person's humanity as they navigate their experience with addiction and substance use disorder. I think what this question is asking is there a way that we can treat addiction through the therapeutic lens of, again, trying to reduce suffering and increase quality of life, and understand that simply because a person is struggling with a substance use disorder doesn't make them any less of a person, and we should still treat them with the dignity and respect that we would use when we treat any person. The idea then is not so much that we try to cure addictions or that we try to some way punitively punish people who are struggling with substance use, but instead we find a way to help them navigate either the mental illness or the trauma that they are suffering with, and we encourage them to incrementally increase their quality of life and decrease their reliance on their addiction to help them cope with the things that they're struggling with. What informs how I view harm reduction? I think this question is hinting at how a therapist or counselor can be aware of their own social locations as an individual. But I think this question is also hinting at the broader, larger cultural context of how do anyone's social locations impact their access to the benefits of harm reduction. So there's definitely a discussion around inequity. There's definitely a discussion around how systems of power intentionally use substance use as a means of oppressing people of color and minorities. There's definitely a conversation around how governments allocate funds for programs that use harm reduction tactics as opposed to traditional abstinence-based programs. And I think all of those things hint at the way that all of these things hint at the fact that addiction is a human experience. There's no culture or race or ethnicity or gender or spiritual background that prevents people from experiencing what we define now as substance use disorders and addictions. And with that being said, it's important to note that even though there are definitely cultural, regional differences in how substances are used and how addiction is handled and talked about, it's most important to keep the focus on how to help the individual that's suffering in their addiction and their substance use, and how to begin adjusting the way society operates to reduce the power imbalances that exist and create a more equitable society for the people who have previously been oppressed. I think the primary difference, as I understand it, between harm reduction therapies and traditional treatments for substance use disorder is that previously there was a lot of intention on the punitive aspects and the depersonalization of substance use, and the focus has been on the poor behavior of a person who is addicted and the negative consequences for society because of individual substance use. And that treatment has been focused on abstinence and the idea of 100% sobriety. And all of that really is sort of taking the focus away from the lived experience of the individual experiencing addiction. And the shift that we're making toward harm reduction is starting to center that individual experience in the process of recovery. And by that we mean, again, like the theme I've been discussing, and the focus has shifted toward improving quality of life. The focus has shifted toward addressing mental health issues and traumas that are comorbid with addiction, and trying to give people tools to cope with those in more effective ways than addiction and substance use. My personal experience with this has been watching many members of my family who have experienced relational trauma or some other kind of negative experience, and they haven't put in the time to understand how to cope with it. And eventually their addiction and their substance use leads to their death, whether that is sort of a byproduct of their addiction. For example, they die of liver cirrhosis, or they die from lung cancer as a result of their substance use. But it's also impacted people in other ways that caused their death, like the way that my father ended up committing suicide after struggling with alcoholism for 40 years. It's my belief that the process of recovery requires harm reduction, because very few people can quit cold turkey or simply stop using the drugs they're using without some kind of titration process or some kind of other substance that helps them reduce their use, but doesn't require 100% abstinence. For the people I know who have survived addictions and are currently in recovery, what has worked best has been finding some way to confront and embrace the issues that they're suffering with, and then learn new skills and develop different behaviors that allow them to cope in more appropriate ways, and for them to join and participate in some kind of community where they receive social support from people who care about them and are there to support them as they navigate their recovery and continue to learn more about how to cope with the everyday struggle of existence. 3 takeaways from this class, and just concerning the topic of harm reduction in general. I think the first takeaway is that everyone is addicted to something. And this could be some kind of substance misuse or abuse, which could be food, which could be alcohol, which could be cocaine. It could also be some kind of addictive behavior, whether that's any kind of compulsion or gambling or sex addiction. We're all using some kind of substance use as a coping mechanism to avoid the unpleasantness of the suffering we're experiencing. I think the second thing I would say is that harm reduction is effective. It's been shown through much research that allowing people to do what they're going to do in a safe and controlled way prevents tertiary damage. It reduces crime, makes it safer for people to use whatever it is they want to use. It costs less, and eventually it contributes to the process of recovery or helping people eventually overcome their addiction. And the third salient point that's important to me is that there are infinite ways to go about harm reduction. And I think this is encouraging for me because when I think about opening my own private practice eventually, I think about giving people outlets and other ways to process and integrate the things that are troubling them and the things that are causing them to suffer. So it may not be something like a prescription for naloxone or methadone, but it may be something like a physical activity or a breathing exercise or some other somatic trick that a person can use to help them cope with whatever they're dealing with in a more effective and less destructive way. So that third salient point is that harm reduction can help anyone if you can figure out how to help them avoid the substance use that they're currently leaning on and give them other ways to process and integrate their experience.